After a complete and good clinical history and examination of hip, we sit down to recognize patterns in what is positive and what is not. Basically, we classify the hip into three: flexion, adduction, external rotation, flexion, adduction, internal rotation, flexion, abduction, external rotation, and none of the above. The four conditions that come in the flexion, adduction, external rotation group are beginning from the head, Perthes disease, then epiphysis, slipped femoral epiphysis, then fracture neck of femur, and trochanteric fracture. So this is the first group. In the flexion, adduction, internal rotation group, in the flexion, adduction, internal rotation group, if there is shortening, there is a posterior dislocation of hip, which can be congenital, traumatic, pathological, either due to septic arthritis or TB stage 3, and paralytic. If shortening is absent, then either the movements, rotational movements are free, when there is simply iliopsoas due to extra articular cause, that means outside the hip, like appendix, cecum, or lymph nodes in the iliac fossa. If rotation movements are involved, then if they are there is spasm, but there is limited range of movement, then it is an erosive arthropathy, which is seen in articular involvement during tuberculosis. Then there is fibrous ankylosis, that means across the joint surfaces you have fibrous connections. Here movements are absent. Attempt to move is painful. And the third stage is when there is bone between the two articular surfaces. There is bone. So this is bony ankylosis. Here there is absent movement and absent pain. Now, bony ankylosis is produced if it is polyarticular. It is ankylosing spondylitis. If it is monoarticular, it is septic arthritis. Then we go on to study the flexion, abduction, external rotation. The first cause is synovial effusion, as in TB stage 1 or transient synovitis. Here range of movement is good and the joint has gone into flexion, abduction and external rotation because this provides the maximum capacity, this position. Then if this synovial thing becomes infected, as in septic arthritis, then there is associated pain, toxemia and fever. The septic arthritis can lead to monoarticular bony ankylosis in adults and pathological posterior dislocation in children. If it is polyarticular bony ankylosis, then you should look for the spine and costovertebral joints of the ribs, and if they are involved, the diagnosis becomes ankylosing spondylitis. About each of these conditions, the sequence of questions is: what is your diagnosis? Why do you say so? Any differential diagnosis? Why not that? How would you investigate? How would you treat? And what is the prognosis? The above description will make you answer these 4 questions. Diagnosis, why do you say so? Any differential diagnosis, why not that? And you have to get prepared to answer how would you investigate, how would you treat, what is the prognosis, and then some questions about the basic anatomy, pathology, pathogenesis, and physiology behind physical science and all those answers that you give. So that is the 8th question. You have to practice the hip again and again for excellent history, comprehensive, valid, precise examination, good pattern recognition in clinical diagnosis, suggesting investigations which are comprehensive but rational. That means they'll give you information and there are less costly also and economic. Rational and economic. So these are the investigations. Then you have to choose treatment which is minimum, safe, effective, economic, and doable by you.